Giving a horse a shot may not be the first thing that comes to mind when caring for a horse, but giving horses shots are necessary for a horse's health. Whether the vet prescribes doses of penicillin or you're giving annual vaccines, learning to give a shot on your own can save both time and money. Today I will be demonstrating how to give a horse an intramuscular injection. Today I have with me my Appaloosa Tennessee Walker mixed mare. She is about 20 years old and she has been an angel always when I give her shots. The first day we got her, she decided she was a little scared and she ran into a tree, cut open the side of her neck, and we were forced to give doses of penicillin to her. Now, penicillin is a thicker substance with a thicker needle and a thicker syringe. This was very difficult in giving to her, but we definitely got through it and she was an angel. She didn't even flinch. We had to give it to her multiple times for days. So she's always been good in giving shots. Now, for an intramuscular injection, there are different places on the horse to give it to. We have the pectorals down here, we have the neck, and we have the hindquarters. Today I will be showing how to give the injection in the neck area. So you want to get the correct position. Up here, running from the head to the withers, is the nuchal ligament. This holds her head up, and you do not want to get the vaccine, in this case the tetanus shot, in this ligament. That can damage it. Down here is the cervical spine, also known as the vertebrae. We have vertebrae in our neck and back, and so do horses. So she has a lot of vertebrae that run right down here. You don't want to get that in the bone. Also, you don't want to be too close to her shoulders. So you want to be a few inches away, a couple inches away from the cervical spine, a couple inches away from the nuchal ligament, and a couple inches away from the shoulder bone. So before I do this, I will go through the correct steps in giving a shot. First, you find the position. So like I said, a couple inches below the ligament, a couple inches above the cervical spine, and a couple inches away from the shoulder, right in this area. You're going to want to pinch some skin and let her know we're coming. Kind of massage the area, pinch the skin. You will take the cap off, quickly inject all the way up to the hub of the needle, and then slowly squeeze the solution in. When you're done squeezing the solution in, you're going to take the needle slowly out and dispose of it properly. Praise the horse and tell her she's a good girl. So, now we are ready. I'm going to do exactly like the steps I said before. I'm going to take off the cap. Oops. All right. Let the horse know I'm coming in this area, about this area. You want to get in the muscle, and you can feel there is a lot of muscle in this area. Pinch the skin, let her know I'm coming. Pull back for blood. You're going to want to make sure you're not in a vein or artery, and push in slowly. Take out the needle, praise the horse, and dispose of it properly. If you were to pull back and there would be blood, you're going to want to find a new position. Some, like a tetanus, may be deadly if you get the shot in the horse's bloodstream. It is a intramuscular injection, and you do not want to get it in a vein or artery. So I would have simply, if I found blood, I would have simply taken it out and found a new spot. Okay, so today you learned to give an intramuscular injection to a horse. The steps were: find the spot, let the horse know you're coming, quickly inject the needle, pull out, make sure there's no blood, and then slowly squeeze back in, take it out. You have learned to give a horse an intramuscular injection.